All right, this is going to be a peer checkoff video for arterial blood gas draw. I've already introduced myself to the patient with my name and my department. I've gotten their name and birth date and verified the doctor's orders for them. We went ahead and felt both wrists to see which side had the strongest radial pulse, and this was the wrist with the strongest radial pulse. So we went ahead and performed the Allen's test, which told us that we did have enough blood for an ABG draw. So I went ahead and washed my hands and I've applied gloves. I'm going to go ahead and clean the area and clean the tips of my fingers and my gloves so that I don't contaminate the site. And then I'm going to go ahead and draw back my needle to 0.5 or whatever the doctor's ordered milliliters. Remove my cap. Okay, and then I'm going to search for that pulse. And now that I found the pulse, I'm going to hold the needle at a 45-degree angle with the beveled side up. And there will be a poke. And if we didn't hit the artery the first time, I would pull back a little bit, but not through the skin, and reposition the needle, poke again. Okay, and then once the blood begins to fill, we'll go ahead and let that get filled up. Hold pressure onto the puncture site and remove the needle and cap that. And then we'll hold that for 3 to 5 minutes or until the bleeding stops, checking the site for swelling, redness, residual pain, excessive bleeding. After that 3 to 5 minutes is up, we'll go ahead and put a Band-Aid on the site. And that's all for the puncture. Then we'll go ahead and take the blood sample. And we'll go ahead and seal it. Remove any excess air. Go ahead and label that with the patient's information. And it can go into the biohazard bag, which will be sent down to the lab for testing. And then all the sharps will go into a sharps container, and I will disinfect the area. All right, Mrs. Miller, do you have any questions for me about what we've done here today?
No, I did not.
All right, thank you.
Thank you.
Have a good day.
You too.